the biggest things that you and I have been discussing is I'm in the middle of a mold protocol and clearing mold out of my system. And I had chronic sinusitis for a long time. Like in and out, I would get sinus infections over the last couple of years. And that's also around the time frame that the mold was kicking up in my system too. So it's funny because we were discussing and you had mentioned doing nasal insufflation, and I was like, what are you talking about? I've never heard of this. Um, so when I shared it on Instagram, the amount of questions that I got of what is ozone, nasal insufflation. So I'm super curious if you can share, what that is and like different ways that you can use it in a dental practice.
Yeah. So ozone, I like to think of as a super oxygen. It's three oxygen molecules, which means it's very unstable and works great, right? It's a great disinfectant. It also, depending on how we're using it, like it can stimulate healing and it can stimulate blood flow. So all the things that as a dentist, I'm trying to do, healing, disinfecting. Um, I use it on the teeth. We use it under the gums. We use it in our water. So I'm using it all the time. I use it if somebody has an infection and I need to control it maybe before we can treat it or kind of knock it down. I can inject it. But the really cool thing is ozone kills bacteria, virus, fungi, and parasites. And there's no resistance to it because it's like an instant kill. So especially things like mold in your sinus, right? Or if we're like, I don't think this is bacterial, but it's something, it's an amazing tool for that because it kills all of it. So the insufflation is where we actually put ozone through olive oil first. We can't actually inhale straight ozone, but you put it through the olive oil first, and then you put it in a cannula, and it coats the sinus membrane, and it starts to take away the biofilm. So it's not like a one and done.
Yeah.
That's why I also said to you, like, depending on how much you need, you
Yeah.
may want your own machine, to have like the ability to treat over and over.
Interesting. How many sessions does somebody typically need when they're doing that?
Um, so if you were my patient, I would probably say like 3 times a week for a month. So like
Oh,
12.
wow. Okay.
Yeah. So
Okay.
depending on kind of the cost of each session,
Yeah,
and if you're like, I need it, my kids need it, my husband needs it, then you may consider doing a machine.
that makes a lot of sense.
Yeah.
What would be signs that someone should probably explore something along those lines? I mean, obviously, like I was getting chronic sinus issues that were not bacterial.
Yeah. Well, I think exploring ozone is great when you're like, I've done the normal things,
Yeah.
so maybe I've done, um, even like, let's talk about periodontal disease, right? We always talk about it being a bacterial driven disease, but I know it's more than that. Like
Yeah.
treating patients, doing swabs, that kind of thing, it's more than that. And so that's when it's a great time to use it. And we use it for all our patients, but you explore it if you're like, okay, I've done the periodontal therapy, I've done the thing, or I did the antibiotic and it's not working. Ozone.